afternoon, this is Dr. Do again. This video is on quarantine special edition, video number 21. Today's topic, I'm going to talk about the lung cancer. Why? Because there's so many cancers. Why I just pick up the lung cancer? Because lung cancer is the one that no screening, no early diagnosis. Usually when it's diagnosed, it's at a middle or late stage. And it's quite common. Not like the breast cancer or the prostate cancer or the colon cancer. It's more easily to screened or diagnosed. Not easily, but usually can be diagnosed at early stage because of the screening tests like the mammogram or the antigen test or the colonoscopy. The lung cancer, however, usually is not, there's no way to screen for it. There's some argument on the special test or CAT scan or something, but it's not regularly used for the preventive measures. So that's why I'd like to talk about this lung cancer. So the prevention and the lifestyle will make difference. Is the lung cancer genetically inherited? Of course. It's not a genetic disease, but the genetic predisposing factors could contribute to this lung cancer. If you have family members with lung cancer or other cancers, or if there's some genes mutation or any other lung disease might predispose the risk for lung cancer. Other than that, lung cancer causes by possible reasons. The confirmed one is smoking, especially the long-term smoking or secondary exposure, or second-hand smoking, which is exposed to the family members who smokes. So you probably know it if you are a smoker. There is a pack year measurement. How many packs you smoke every day, how many years have you been smoking. Even though the remote smoke, for example, remote smoking, you smoked when you were young and then you quit it still can count as a pack year, still has impact for long term, but just less severe compared to those continuously smoker. And the chemical exposure, if the air is polluted by the chemicals, that impose the risk of lung cancer. And other causes, probably previously lung infection, especially those calcification, like TB, for example. There's no clear correlations between the TB infection and the lung cancer. I'm talking about just one example. If you have the calcification in the lung, or fibrosis in the lung. So that means it's already the cells undergoing abnormal change. Those cells may trigger the proliferation of malignant change. So I'm not saying TB has the risk of lung cancer or fibrosis, cystic fibrosis has increased the risk of lung cancer. However, the previous lung damage predispose the risk of lung cancer, any of the possible. Maybe you know it, maybe subtle without even know it. So that's the causes. In general, the cause of lung cancer is not clear. Some of the fungus infection, for example, may predispose the risk, increase the risk for the lung cancer. What are the symptoms? Pretty much at early stage, nothing. You imagine a lung, left and right, other lobes, and there are multiple alveoli, so less than 1 centimeter of damage cannot cause the difficulty breathing or breathing problem or hypoxia unless it's near the center, near the trachea. So that's usually symptomatic. So that's why when lung cancer is diagnosed, it's usually in the middle or late stage. At least 1 centimeter or above can be identified. And usually the presenting symptom is dry coughing. You probably have dry coughing for a while. You thought, I had asthma. it's allergy and then it's going a couple months and then you feel better for some reason. Those kind of dry cough may, especially for the people older than 50 years old, because usually when you're getting older, the allergy, the asthma is getting improved. Why? The immune cells not as aggressive as before. So like the asthma or allergies, because your immune system is overreactive. So for the older people, older than 50 years old, if you have persistent dry coughing, don't think it's allergy. Just go and check it out. Make sure it is nothing serious. So what kind of problem? Usually hemoptysis, which means coughing out blood. If that's the case, like I said, go see the emergency. If it's a strict blood in the sputum, then you schedule appointment. But if the cough ups, if the hemoptysis pulling out, that means the cancer might invade the large blood vessels. Go to the emergency room to check it. That probably the diagnosis of whether you have or not having lung cancer. That's very critical. Again, back to the symptoms, dry coughing and strict blood in the sputum. May or may not have the chest pain. If you had chest pain, means the the cancer probably in the peripheral near the pleural area. So the pleural is very sensitive compared to the lung itself. So if it's a peripheral, touch the membrane structure, so that gives you the pain feeling, which is a good sign. But usually, and also the peripheral lung cancer, it's easier to treat compared to the cancer at the center. So this is just the general educational information for the lung cancer, and I'm not here to scare you or to make you feel panic. But I just want to say it again: if you're older than 50 years old, particularly if you're a smoker, either remote or currently smoker, you have long-term persistent coughing, and really check with your physician to do some tests, CAT scan, or other tests to make sure to exclude or diagnose whether you have the lung cancer or not. If you have, like I said, you have the coughing up, pulling blood, hemoptysis very severe, then go to the emergency room. No matter, regardless whether it's cancer or not, if hemoptysis of a large amount of blood means something is going on, need to be treated. So go to the emergency room. So that is the, in terms of prevention, of course, lifestyle change, quit smoking, the first one. Try not to get the secondary exposed or secondhand smoking, or wearing mask currently is not a bad idea, especially in those polluted environment, to prevent the fume or chemical breathed in that will limit or decrease the risk of lung cancer. So this is the, and of course, body weight management, limited aspiration, the stomach content backflow to the lung. Those are all the good measures to prevent lung cancer in the long term. So that's the briefly introduction of the lung cancer, how to prevent it, and when you need to see the emergency room, when you need to call your physician. I hope it helps. And thank you for watching. I will see you next time.